All right, now that we have this fancy AED machine, I just want you guys who are on the board to understand how to help the people who are trained to respond to emergencies. First thing, blowing the whistle 3 times means that we have an emergency that needs to be dealt with. Things that you can do to help out a first responder, like I'm trained to be a first responder, is call 911. It doesn't matter if we call them 65 times, as long as somebody has called, because everybody may assume everybody else has called. We just need to make sure that they're called. We also need to help them get down to our location. So send somebody up to the top of the hill to flag them down as they come. The quicker they can get there, the quicker they can save a life. We need to move aside the transition racks to make sure if we have a full-blown ambulance coming that there's enough width to go through there to get all the way to the water. We need to have all of our emergency equipment down by where we're going to pull the victim out. So we need to have AED, backboard, additional medical staff that we've hired. We're going to need somebody to direct the athletes that are not involved in this. So if we have people out on the bike course and we need the ambulance to come down the Boulder Beach ramp, having a volunteer up at the top stopping from athletes from coming down, or just letting them know what's going on so that they don't get involved and they don't get in the way and they don't get hurt. In the event of an emergency, there are a lot of jobs that can be filled. So if you're asking yourself, what can I do? Make sure there are no athletes interfering with the rescue process. If there are people in the way, get them out of the way. If there are people still swimming and the emergency happens in the water, get them out of the water, because the first responders are going to be paying attention to the current victim. We don't have a whole lot of backup, so we don't need another emergency happening while we're trying to rescue someone else. So get everybody else out of the water, get them out of the way. Providing communication during an emergency is a very important function. You can communicate with our volunteers who are out on the course. You can communicate with the park ranger to let them know something's going on. You can communicate with our athletes who are on the course who have no idea what's going on, and you don't want them to get injured or get involved or get in the way. So communication is a huge asset in an emergency. The best thing to do is not ask the responder a bunch of questions, because then that takes the concentration from the victim to you. You know, like, where do I need to go? What do I need to do? Look, if the first responder needs something, the first responder has been trained to ask for things out loud and, you know, say, hey, I need you to count for me because I'm having a hard time with all the noise, or whatever, you know, you call 911, you do this or that. The first responder should be able to ask you for anything that they need. So don't ask them any unnecessary questions unless, like, 911 says, hey, I need to know this information. Sure, ask that question, but don't ask any unnecessary questions. In an emergency, I just want to let you guys know what you're seeing when you see this equipment. So in all the lifeguard bags we have should be a face mask, which goes on the person's face, and somebody trained to use that can use that. And there should be alcohol pads and wipes. I don't know what that is, but there's a pair of gloves. So whenever dealing with an emergency, get your gloves on first, ask questions later. Okay, so this is the AED machine that we have. Big Velcro strip, get it off, get it open. Okay, so the key is already plugged in. This is what it'll look like when you open it. You just turn it on. Get the pads out.
Remove clothes from patient's chest.
Right here.
When patient's chest is bare, open gray plastic. Look carefully at the pictures on the white adhesive pads.
This is the one that goes on the lower left. This is the one that goes on the upper right.
Exactly as shown.
Okay, so you're going to take those off and put them on our victim here.
In place, peel the second pad.
This is your pediatric key.
Exactly.
Or if there's a kid involved.
Press firmly infant child mode. Remove clothes from patient's chest. Adult mode. Remove clothes from patient's chest.
And that's less than 55 pounds.
Peel white pads from gray plastic case. Attach pads to bare skin.
Will give you instructions as you go along. And this is the start, this is the turning on button, and this is if the shock needs to be delivered. And the rest of it will walk you through, or it'll tell you for more information, push that one.
Case. Attach pads to bare skin.
Not so scary.
Exactly as shown.
Thank you. Good night. Okay, so we've pulled the victim out of the water. We make sure he's not sitting in a pool of water because we don't want to deliver electricity when he's got a portion of his body in the water. So I have my gloves on already at this point. I have a rescue mask for him. If you bring me the AED and you're assisting me with the AED, you need to get some gloves on, because if we do revive him, he's probably going to vomit, and there's going to be some fluid of his or her involved that you probably don't want in your hands. So before we place the pads, we have to make sure that the chest and the abdomen that we're going to apply the pads to are dry and free of hair. In this kit, they do have a razor. That's one of those dry surgical razors that you can shave off hair. You can take a pair of pads, put them down and rip them off, and it's like a quick wax job. I know it's not very comfortable, but it'll get the job done. And just make sure you towel off the chest, or just take your shirt and wipe it off. We just need it, dry enough to where the electrical current needs to go where it's going, and that the pads stick to the person. Okay, so while I'm doing CPR, the best thing that somebody who's not trained with the AED can do to help is just get the equipment out. I'm going to be doing the CPR, the chest compressions, the breathing. Richard here is going to open the machine. Remember, the pads are right here. So he's going to, this machine has you turn the item on, or the machine on first, and it'll tell you what to do.
Remove clothes from patient's chest.
Okay, so if we haven't already, we're going to remove the clothes from the chest.
Peel white pads from gray plastic case.
Okay.
Attach pads to bare skin exactly as shown.
There's a picture on the actual things. Make sure you can go around my hands. So just you're going to put one up here on the right side of the chest and one in the lower left abdomen.
Attach pads to bare skin exactly as shown. Look carefully at the pictures on the white adhesive pads. Peel one white pad from the gray case. Place pad exact. Stay clear of patient.
Stay clear. You don't want to touch the person because they don't want to get your pulse through this.
Stay clear
and they don't want anybody else getting a shock.
Analyzing heart rhythm. Shock advised. Stay clear of patient.
Okay, push the shock button.
Orange button now. Shock delivered.
Stay clear. Stay clear.
Emergency medical services have been called. It is safe to touch the patient.
So they tell you it's safe.
CPR.
Do it again.
For help with CPR, press the flashing blue button.
Push that so you
Place the heel of one hand in the center of the chest between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
Okay, so basically you'll just keep doing CPR until one of 6 things happens. When you go to put the chest pads on, the one here and the one here, if there's a pacemaker, it'll usually be on the left-hand side. But if you see a scar anywhere on the chest, that might indicate they have one. Do not put a pad over a scar. Put it right next to it, or just work around it. You can put like one on the chest and one on the back if you have to, but just the amount of cabling that you have, it's best if you have them where you're supposed to have, you know, what it shows in the picture here. I think that's it. I think we're ready to handle these emergencies and go. I just wanted to mention at the time of this filming, the club does not have training pads because we should already be trained for this. These are my own personal. I bought the same AED model for my home. So if you're looking for these items, the club does not have these items.